Good day, amazing people. Welcome back to this session. In this video, we will continue our talk on cardiovascular geriatric clinical care. Previously, we described normal age-related changes in the cardiovascular system, explained reduced cardiovascular reserve, how aging limits stress response and compensation, recognized atypical cardiovascular presentations in older adults, and identify early indicators of decompensation. By the end of this session, the learner will be able to 1. Explain the relationship between cardiovascular aging, orthostatic hypotension or syncope, and falls. 2. Interpret blood pressure patterns safely in older adults. In this session, we will see how orthostatic hypotension and syncope contribute to falls. Orthostatic hypotension occurs when blood pressure drops significantly upon standing. There are different contributing factors which include aging, autonomic dysfunction, dehydration, medications, example, antihypertensives, reduced baroreceptor sensitivity. The clinical significance include 1. Major cause of falls. 2. Predictor of cardiovascular instability. Do you know that falls may be the first sign of cardiovascular instability? The potential mechanisms include postural hypotension, arrhythmias, reduced cerebral perfusion. It's important to note that falls should never be dismissed as purely mechanical. Now, let's see how blood pressure should be interpreted in older adults to prevent harm. Hypertension in older adults often has patterns that differ from those of younger adults. Common features include 1. Isolated systolic hypertension. This is when the systolic pressure, the top number, is high, but the diastolic pressure, the bottom number, may be normal or low. It often occurs because aging blood vessels become stiffer, so pressure rises more during each heartbeat. 2. Wide pulse pressure. Pulse pressure is the difference between systolic and diastolic pressure. In many older adults, the gap becomes wider, for example, 160/70. A wide pulse pressure can suggest reduced vascular elasticity and is linked to higher cardiovascular risk. 3. Increased risk of stroke and heart failure. These blood pressure patterns increase strain on the heart and blood vessels, raising the likelihood of complications such as stroke and heart failure, especially when combined with reduced cardiovascular reserve. In conclusion, blood pressure in older adults should not be interpreted by numbers alone. Therefore, advanced practitioners should consider trends over time, the patient's symptoms, and functional status. Overly aggressive treatment can increase the risk of dizziness, orthostatic hypotension, syncope, and falls. So targets often need to be individualized rather than fixed. Thanks for watching. See you soon.